Hello and welcome to the MiCare Champion Cast. I'm your host, Brian Peters, CEO of the Michigan Health and Hospital Association, and today I'm very honored to welcome our new MHA board chair. He is the president and CEO of Bronson Healthcare, Mr. Bill Manns. Since joining Bronson in 2020, Bill has overseen a full range of services from primary care to critical care across more than 100 locations. He's here today to share more about his journey to healthcare leadership, what's top of mind at Bronson Healthcare, and what work lies ahead for this 2025-2026 MHA Board of Trustees program year. Bill, welcome, and thank you so much for being with us today.
So, Brian, it's truly a pleasure for me to be here. I'm really excited about this opportunity.
Well, thank you. And let's kick off our conversation today by learning a bit more about your history and your journey to healthcare. You did such a fantastic job at our MHA annual meeting about a month ago, sharing that journey. And I know our listeners would love to hear a bit more about that.
Sure. No, thank you. Thank you for your kind words, too. So, yes, I've got somewhat an atypical journey, I guess. I grew up in inner city Detroit. My parents were from the South, and in their minds, a successful career meant you were either a doctor or a lawyer, maybe a banker, right? And so from a very early young age, they told me, Bill, you want to be a doctor when you grow up. So I went through life thinking I wanted to be a physician. Went to the University of Detroit Jesuit High School, studied a lot of pre-med materials there. Was fortunate enough to get into the University of Michigan. I had a 4-year free ride to Michigan State, and so I had to decide between the two schools. My love of the maize and blue won out, much to my parents' chagrin. And so I went to Michigan with the same mindset, thinking I wanted to be a physician. Took a lot of the requirements, the prerequisites to get into med school. Got through organic chemistry, biology, biochem, et cetera. And in the summers, when I was in college, I worked at the Wayne County Medical Examiner's Office, the morgue, right? And I saw a lot as a young man. I saw a lot of people coming into the morgue who looked like me, and it was very disturbing, quite frankly. I did that for a couple summers, and my junior year, walking across Michigan's campus, and those who went to Michigan will know the Diag is kind of the place to be. And I saw a sign that said careers in healthcare and had administration in very, very tiny letters at the bottom. Not a clue what a healthcare administrator was, Brian,
Right.
But I applied. Fortunate enough to get in. And I never looked back. I just saw the impact that healthcare administrators could have on their communities. And so I finished up my time at Michigan. I crammed all the prerequisites for Michigan School of Public Health into a year. Was accepted into the program, and started a wonderful career after that. So yeah, so it's a pretty cool journey from being a kid thinking I wanted to be a doctor to ultimately becoming a healthcare administrator.
Well, I know you've had an opportunity to experience hospital and healthcare leadership in states beyond Michigan, including California, which I have to imagine was just a very different environment from Michigan. And can you talk a bit about how those experiences informed your leadership today?
Yeah, no, it's a great question. So yeah, I worked in and around Southeast Michigan. Being a Detroiter, I never thought I'd leave, and had an opportunity to work with Wright Lassiter out in California. Wright hired me a month after he got to Alameda, and I had a lot of experience working with unions, being from Detroit and working in environments where lots of unions. He was from Texas and had zero union experience,
right.
And so he hired me as his chief operating officer. And at the time, I thought there can't be many differences between Michigan and Detroit when it comes to healthcare. Nothing could have been further from the truth. I found myself often searching for, well, what are the similarities here? My wife and I would joke about, does California realize that there's other parts of the nation, that they're actually connected in a part of the U.S.? We worked in an environment where there were 9 unions. Even the physicians were organized. And for me, it was, how do you really ensure that the unions aren't speaking for the people which they represent in a way that was inconsistent with what the people wanted. And so that transparency of leadership became really important from my perspective. But in terms of the differences between the two states when it came to healthcare delivery, at the time, the state of California had something called Section 17,000s. And I really appreciated their desire to ensure that everyone who was in that state had access to coverage. And so it took on an added sense of responsibility.
Mm-hmm.
And I see the state of Michigan actually leaning into that, with the Affordable Care Act.
Mm-hmm.
It was nice to see the entire nation start to swing back and see the importance of access for everybody. So cool experience working in California. I'm really happy to be back in this great state of Michigan. There's no place like it.
Well, I agree, and we're thrilled that you're here, Bill, and we're also thrilled that you're leading the MHA this program year, and it just speaks to what high regard your colleagues hold you in around the state. And we have a very diverse state, from small, rural, large academic medical centers, everything in between, and you are the one that your peers selected to lead this association, and with good reason. You have been just a fantastic leader, and you're leading an amazing organization. Bronson Healthcare is, of course, held in such high regard. In fact, I just saw the news earlier today about the U.S. News and World Report recognition. Congratulations again on that. Can you talk a little bit about Bronson and share with our listeners a bit about the system who may not be familiar, and some of the things that you're proud of that's happening right now?
Yeah, no, thanks, Brian. I really appreciate that. Thanks for the kind words. And it is truly an honor to be chairing the MHA. When I think about Bronson, we actually are in the southwest part of the state. We're the largest employer in the region by far. We've got 9,334 employees as of Monday morning. We're about a $1.9 billion organization in terms of net revenue. 4 hospitals. So we have a large level 1 trauma center in Kalamazoo. We've got a community hospital in Battle Creek. We've got a critical access hospital and a really small micro hospital in Paw Paw and South Haven. We've got about 72 outpatient practices. So a really diverse organization that's comprised of about 10 different companies. We've got a couple wellness centers. Absolutely love Bronson. We were voted or named one of the top 15 health systems in the nation a couple years ago. Known for a high-quality service. I just absolutely love the culture. The men and women who are part of Bronson have helped create phenomenal organization. I can't say enough good things about it. For me, it's really important that we provide access to everyone in that community. When I think about the MHA and who we represent across the state, a lot of similarities with Bronson, be it from rural to large academic medical centers, right? When you mentioned that, I was thinking about my friend J.J. Hodshire, who's the CEO of Hillsdale.
Right.
I was on his podcast a few weeks ago, and just the passion that J.J. has for rural health. And then I was also thinking about my friend David Miller at the University of Michigan, and you can't get much more larger or more complex than the University of Michigan. So I love that the MHA represents everybody in this great state.
Absolutely. It's one of the wonderful aspects of this job and working at this association, no question about it. Well, Bill, you mentioned what an amazing organization Bronson is, and you're responsible for an incredible team of employees, and you're also responsible for everyone in the community who needs access to care. All of those individuals at this point are aware of what transpired over the July 4th weekend when President Trump signed the One Big Beautiful Bill Act. And while there are many moving parts, and we're all trying to grasp the actual impact of that legislation, from your perspective as the leader of Bronson, and for that matter, the chair of the MHA board, how are you thinking about this in terms of the balancing act, right? We know this is going to impact us in a negative way, but you have to maintain optimism and keep the train running. What are your thoughts at this point in time as we move forward?
You know, Brian, you nailed it. I think of it as a balancing act, right? I think the realities of the negative impact that the One Big Beautiful Bill Act will have in terms of access, the decrease in reimbursement, all the negative things, the headwinds that it'll create for health systems and for people trying to get access to health. I think it's important that we do a few things. One, we've got to do a better job of educating the public about just what's coming.
Mm-hmm.
Two, we really have to advocate even stronger with our legislators. It is when I think about all the things that are going to happen without someone stepping in before we go over the cliff. Three, I think we've got to continue to be optimistic and not panic. The organizations, as I mentioned, Bronson is the largest employer in Southwest Michigan by far.
Mm-hmm.
And I think it's incumbent upon me as a leader to really help guide us through the incoming headwinds in a way that I don't want to look forward to massive layoffs.
Mm-hmm.
So we've got to be smart about our growth as we move forward. We've got to be smart about retraining individuals. We've got to be smart about providing access to people who may actually lose their insurance.
Mm-hmm.
And what's that mean for uncompensated care? Folks coming into our emergency departments because they were afraid to seek care sooner because they thought they might have to pay for it. So how do we begin to educate the public to say you can still receive services and we'll try to work with you from a financial perspective, et cetera. So a lot of education, a lot of advocacy, most importantly, a lot of thoughtful changes to a very complex system.
Well, I think that's really well stated. And while we have a role to play in terms of advocacy, and we'll continue to do that at the state and federal level, no question, I want to get into some of those other issues with you in a moment. Let's stick with that idea that, it can't be business as usual anymore. And I think it's fair to say even before the One Big Beautiful Bill Act was on the table, leaders like yourself thinking about how we can do things differently and better to protect access to high quality, affordable care. But from your perspective, does this accelerate that notion that we have to modernize our approach to healthcare delivery and financing?
Absolutely, Brian. I think I'll give you a couple examples. When you think about pre-pandemic, there was a lot of emphasis on telehealth.
Mm-hmm.
And as an industry across the board, we really couldn't move quickly, and there wasn't a lot of adoption of telehealth, right? The pandemic hits, and folks are no longer coming into the office like they were. And we saw telehealth explode.
Absolutely.
Because of the realities of the situation in which we found ourselves. Same thing, we've got an attack, I'll call it an attack on healthcare. And how do we respond? And I think that same notion of consumerism, finding lower cost environments, ensuring that patients still have access in a different way, it will accelerate the change we have in our health system. And we've got to use your word, we've got to modernize, right?
Mm-hmm.
Having said all that, I think this is such a drastic act that we're going to have to continue advocacy. And I think you and the MHA did an amazing job, both at the state and the federal level. I know you worked with the American Hospital Association.
Mm-hmm.
You were on the Hill talking to anyone who would listen. And so I want to say thank you to you. It means a great deal to know that the leader of the MHA is willing to do that and take action, not just give lip service. But for us, we've got to continue as an operator, as a CEO of a complex system, to think about how we reach out to the public in different ways.
Mm-hmm.
I talk with my team all the time about we've got to be a health system without walls.
Mm-hmm.
If people think that they only receive their care inside the four walls of a hospital or inside the four walls of a practice, I think we failed.
Mm-hmm.
And so how do we meet the public where they are? And so it is going to be creative things like telehealth, asynchronous delivery of emails, et cetera. How do you ask your physician questions? And by the same token, we've got to make sure that we're not burning out the staff.
Mm-hmm.
So that the providers, we're not just saying do more, do more, do more. I think it's incumbent upon us to work with them so that we can do differently.
Right. So, Bill, on this notion of doing things differently in healthcare and the constant evolution, we think about emerging technology, right? And artificial intelligence is top of mind for everyone. It's impacted just about every sector imaginable. But can you talk about how technology is playing a role at Bronson?
You know, Brian, it's such a great question, and thank you so much for asking it. Two things we're looking at Bronson. One, revenue cycle. And are there opportunities anywhere along our revenue cycle to really implement AI in a way that is additive and more productive, right? And so be it all the way from ensuring that as bills go out the door, all modifiers are on them, et cetera. We're also, and I'm actually really excited about this, how do you reduce the administrative burden for our providers? And what's that look like, right? Whether it's through ambient listening, so that those providers don't have to spend more time at home typing when they'd rather be with their families or relaxing. And I think the notion of how do you use AI in a way that reduces expense? How do you use AI in a way that ensures that we're being paid appropriately? But most importantly, how do you use AI to ensure that you are taking care of your caregivers so that that burden doesn't really fall on those individuals? When I think about professionals, healthcare is one of the few professions where we'll take people who are at the pinnacle of their career and then ask them to type.
Right.
I can't envision a lawyer in court pausing to type his or her argument, right? But in healthcare, as soon as that provider is done with the patient, they'll either leave the room and type. Sometimes they'll type in the room, or like I said, they'll go home and type. So I love the use of AI to reduce that administrative burden for our leaders. And
Sure.
For
And one of the other benefits clearly would be that provider would have more time to spend face-to-face with the patient, right? If they don't have to be engaged in all of this paperwork and bureaucracy.
You nailed it.
And Bronson's really one of those organizations that's been so thoughtful about thinking outside of the four walls of the traditional acute care community hospital, right? Whether it's the entire care continuum or frankly beyond when you get into the social drivers of health, right? I mean, you have to see that a lot through your footprint that you serve.
Oh, you're spot on, Brian. So for me, it's also about partnership. And so one of the things that we talk a lot about is how do we partner? It's not important that Bronson owns, controls everything in that environment, but how do we partner with others so that we can leverage the strengths of other organizations and leverage the strength of Bronson? It's, again, if you put the patient at the center and say, do the right thing for that patient, and you bring other partners into that equation, I think that's where the magic is.
Right. So let's get back to the advocacy discussion and set the One Big Beautiful Bill Act aside for a moment because there's a lot there to unpack. But there are a number of other issues at the state and federal level that are going to be front and center between now and the end of this calendar year. And we talk about the 340B drug pricing program and site-neutral payment and the Medicaid budget even here at the state level, which is still under discussion and deliberation. But to you, as the CEO at Bronson, Bill, what's top of mind? What keeps you up at night when it comes to public policy and financing?
Yeah, actually, Brian, you nailed the top two. I spent a lot of time with the team talking about 340B. It's been under attack. It feels like my entire career. It's such an important component, and I think the lay public, they don't have a good understanding or appreciation for the role that 340B plays in the overall delivery of healthcare. I think if they did, they too would help protect it. And so we've got to do an even better job of explaining and telling our story around 340B. The notion of site-neutral payments. There is nothing neutral about site-neutral, right? You hear it and you go, oh, okay, well, neutrality makes sense. No. Hospitals deserve to be paid more because of the 24/7 nature of the business. Often hospitals receive much sicker, much more complex patients than patients that are cared for in an outpatient environment. So on the surface, you say to someone, site neutral, that an outpatient surgery center should be paid the same as a hospital. On the surface, it makes sense, but that outpatient surgery center isn't open 24/7. That outpatient surgery center doesn't have the same regulatory requirements often. That outpatient surgery center is not, as I said, seeing the same level of sick and highly complex patients. And so those two things do keep me up quite a bit at night.
Right. And you're treating patients in the hospital setting that may or may not have insurance. Coverage of any sort.
You got it.
Right. So it is very different. Talk to me about 340B and what does that mean to Bronson specifically?
Yeah, it means a great deal. And so we've actually quantified the impact of the 340B and we're adjusted, went away, et cetera. For us, we actually use the savings for 340B to help take care of our entire community. So last year, we provided $147 million worth of community benefit.
Wow.
A large component of that was on an undercompensated care. And so if 340B were to go away, it would be incredibly difficult for us to provide that same level of care. When I say $147 million, that's $403,000 a day worth of community benefit. And so we're in a position to do that in a large part because of 340B. And so that going away, I really see the entire community being hurt by that.
Well, and it would be one thing if we were talking about potential disruption to that 340B program and change to the site-neutral payment methodology in a vacuum. But to our earlier conversation, to think that those two public policy decisions could come in the wake of this One Big Beautiful Bill Act, where there's going to be unquestioned reductions for hospitals, those are elements that come together to create this perfect storm, right?
It's beyond a perfect storm. I mean, you've got the double whammy of those two, coupled with what's currently going on. It's unimagineable. As my friend JJ would say, that's DEFCON 9 time at that point. I can't even. It would so drastically change not only Bronson, but every hospital across this great state would be so adversely impacted that I think it would be hard for operations to go on at all in many hospitals. We talked about, and I hear a lot about the impact that the One Big Beautiful Bill Act will have on rural hospitals. Those other two, 340B and site neutrality, would threaten the closure of virtually hospitals that I think many of us think are in great standing, or health systems that many of us think are too big to fail. I think we'd start seeing them really struggle.
Absolutely. So we tend to point our listeners all the time to this notion that advocacy is not a spectator sport. So from your perspective, Bill, both as the CEO of Bronson, but also the chair of the MHA board, what would you advise our listeners to do at this moment in time, given everything we've been talking about? How could they get engaged in the process? What should they do?
It's such a great question, Brian. So I think they've got to write, they've got to call, they've got to email their legislators. I mean, state reps, senators, you name it, and get ahead of this. I'd say go to the MHA website, learn more about 340B. As you learn more about the program and all the good things that come of it, educate yourself about site neutrality and what's your hospital in your community, what's your hospital doing. But again, I think you can't underestimate the impact that the general public calling their senator, calling their state rep, and saying, hey, I'm concerned about this, I'm concerned about that, or an email. So I think those things, to your point, it's not just a spectator sport. Don't sit back and think somebody else will do it. Oh, yeah, that sounds bad, and it won't impact me. The reality is we're all in this together. I had a mentor who used to say to me, the challenge about health is that if someone gets sick enough, he or she is going to end up in the emergency department. And as our emergency departments become overwhelmed, it has an impact on that entire hospital. As that hospital in your community becomes overwhelmed, it has an impact on the practice in your community. And it becomes this ripple effect.
Right.
And so to sit back and think, well, I've got an insurance card or I've got coverage and that doesn't impact me, ultimately it will.
Absolutely. So, Bill, we're only about a month in to this new MHA program year. We've talked about some of the top of mind issues, certainly in the public policy space. But as you know, we have a strategic action plan at the association every year. And we're very proud of that work that extends, in many cases, beyond the domain of public policy and advocacy, whether that's patient safety and quality improvement, cybersecurity, workforce, you name it. From your perspective, what do you hope to accomplish during this MHA program year? When we're together at our annual meeting next June, what is a priority that you'd like to have with a check in the box?
No, thanks, Brian. Thanks for asking. For me, it really is around infant mortality and maternal health. When I look at some of the infant mortality rates that I see in my community, there are literally some third world countries that are doing better than we are with some of the cohorts within Southwest Michigan. We've got, and that's one area where you start to see the health disparities jump out at you. Women of color have a mortality rate during birth that is at times double or triple what their white counterparts have.
Incredible.
And when I think about that and think about how can we impact that just in my community, and then how do we impact that across this great state of Michigan? And you think about the women who, if we can reach some level of polarity, that don't have to die. And as we attack this issue as a community, I think all boats rise, right? If we can address mortality rates across the board and give infants an opportunity, when I think about this issue, it is the one area where as soon as we're born, I mean, we're born without bias or prejudice, et cetera. If we can get equality there, then I think that's a great footing on which to build and grow as a community and I think as a nation, quite frankly.
I absolutely agree. And to state the obvious, given some of the changes in terms of public policy coming out of Washington, D.C. with executive orders this year, I think that work has been complicated. It's been challenged. But to your point, we have to continue.
Yeah.
We have to find a way forward because it is that important.
Yeah, no, I agree, Brian. And I think, the work has been challenged. The work is complicated, and we will follow the law. And I think we need to look at the data. We can do two things at the same time, right? And nothing I've read, nothing I've seen would ever encourage people to not provide high-quality care. And high-quality care for all human beings across this great land is something that we should strive for.
Without a doubt. I think that's safe ground for all of us to have that shared mission.
Right. And to provide that high-quality care to everybody that should be receiving it is also safe ground.
Right. So to your earlier point about partnerships, right?
Yeah.
This seems to be one of those challenges for the field where we can't solve it on our own working in silos. We have to collaborate with other organizations, other entities within our communities that may not be historic partners with hospitals and healthcare, right? Isn't this a good opportunity to do that?
It is a great opportunity to do that. And I think to your point, some historic partners, some non-historic partners. And what are those organizations that have clout in various communities? I mean, there's often talk about the Black church. Well, that's kind of a no-brainer, right? What about the local supermarkets? And how do we partner with them? What about the bodega? How do we partner there? And so being creative and viewing anyone who has interest as a partner. And those organizations that might not have interest, as we go out and explain some of the challenges that the hospitals and health systems are facing and ask for their support. I've been more than pleasantly surprised at the number of organizations who want to lean in, who do want to partner. I'll use the example in Battle Creek, we have the Burma Center. It's a fairly large Burmese population there. And in partnering with them to better understand what are their health needs, how can we work together to improve the health status of that community? Well, the executive director leans in and says, absolutely. And so there are tons of opportunities for non-traditional partners to really improve the health status for us all.
So you've raised a very high priority and a very important one at that. Are there other issues that are on your mind that you'd like to see the MHA board and the association rally around?
Yeah, so I think infant health and maternal health are really important. The other big one, Brian, the behavioral health piece.
Yes.
Right. We started, and it's such a struggle, such a challenge. I'd like to shout out my friend, Dr. Mark Eastberg, who runs Pine Rest and is on the board of MHA, and a strong advocate for the behavioral health rights that the patient should have in our state and across the nation. I do think behavioral health is something that the younger generation who grew up through the COVID pandemic, who spent a year or two not in the classroom with their colleagues and friends, have been adversely impacted. I think all of us have been impacted, quite frankly, by behavioral health. And there's a stigma associated with behavioral health that I like to believe is going away.
Mm-hmm.
And I think the MHA, and I think anyone that's running the health care system can really help in that.
Mm-hmm.
And so I talked about advocacy. The component of advocacy is education. And there's no stigma associated with breaking your arm,
Mm-hmm.
right? That can
Right.
happen to anyone. But if someone has a family member who has a behavioral health need, it's not looked upon the same, unfortunately,
Mm-hmm.
by some. And I think we've got to get past that stigma. So the first step is that acknowledgement that there's a challenge or there's a need there, and then to move that forward. The funding for behavioral health is also a challenge.
Mm-hmm.
The advocacy in that arena has not been as strong, in my opinion, as advocacy elsewhere. And I think that is reflected in the way in which we reimburse behavioral health, unfortunately.
Well, I think you're exactly right. And I'm a big believer in that old notion that sunlight is the best disinfectant, meaning the first step in solving any complex challenge is exposure. And let's talk about it and let's destigmatize it, to your point. And I do see that. I see the progress that's being made. We're nowhere near where we need to be yet. But at least people are talking about it, and we have some very highly regarded celebrities and sports heroes and politicians and business leaders who've been very open about their own personal mental and behavioral health challenge. And I think that's for the good. That's positive that we destigmatize it. You know, one thing that I see all the time on my member visits to our hospitals around the state, and it could be a small rural facility or a large urban facility, is behavioral health patients being boarded in the hospital emergency department, right? And what a tragedy for that individual and the family. But it's because we struggle to place that individual in an effective setting with the effective and appropriate caregivers, right? Isn't that a challenge that we all share?
Oh, yeah. I can't think of many, if any, hospitals that aren't boarding patients in their emergency department. And when you think about an ED, right, incredibly busy, chaotic, hectic, lights, sounds, etc. Often the last place, if you're going through a behavioral health crisis, that you'd want a patient. To have patients, and especially some of our adolescent patients, where the placement of those young people is even more difficult in an emergency department for not just hours but days, and in some awful cases weeks. It's very sad, and I think, and I've been in this business a long time, and that is one of the persistent challenges for many hospitals and health systems across this great state. And so it's time for us to really step up and try to do something about it.
Well, in a similar vein, you know, when I am visiting our members, we continuously hear about this challenge of violence in the hospital setting as well, and particularly our frontline caregivers who too often are subject to verbal and sometimes physical abuse by patients, by their family members and others. What does that look like from your perspective? Are we getting better, and has this discussion at the state and federal level, passing legislation and then signage in the facilities, all that, is it starting to make a difference or not?
Brian, I'd like to say yes, but I'm not sure it is. To watch so quickly, and as I go around and talk with staff, I had a nurse who said to me, during the pandemic, we were heroes. And now people are treating us like we're zeros. And that notion of violence against caregivers is abhorrent, in my opinion. Here we have men and women who've dedicated their lives to taking care of others who are being attacked. Yeah, we need to strengthen the legislation around it. I know the governor in the state has done some things, and the fine has doubled, et cetera. But at the federal level, too, I think a quicker response and a stronger response and some examples and consequences that people are paying for their actions is definitely needed and warranted. I'll give you the example, airlines. At one point, there was you started to see an escalation of violence against those who work in the airline industry. Quick legislative action, and you've seen that violence decrease.
Right. That's now a federal felony offense
It's now
if you
a federal,
assault a flight attendant.
Exactly.
Right?
And so I think we need to have the same thing for our healthcare workers who, and nothing against flight attendants but our healthcare workers have literally dedicated their lives to caring for others.
No question. So the Federal SAVE Act is really what you're referring to,
Exactly.
and we've been advocating for that along with the American Hospital Association.
Yeah.
But it'd be great to see that make its way to the finish line.
Yes. Yeah, I can't wait.
Yeah. Any other issues, Bill, that are top of mind for you?
Those are the ones that really cross my mind the most, Brian. I think if we really hit infant and maternal mortality and morbidity hard as an organization, as a state, I think we can move the needle there. The behavioral health piece has been a persistent challenge. Yeah, I think you've done a good job of pulling things out. So thank you.
Thank you so much. And Bill, we really appreciate your time today to appear on the podcast, but even more importantly, your willingness to step forward and lead this association during what is an incredibly turbulent time for all the reasons we've been discussing today. But I'm very optimistic with your leadership. We're going to have a positive year on behalf of our members and the communities that they serve.
Well, Brian, no, thank you for your time and thank you for your leadership. MHA is a strong association, and under your guidance, I'm sure this will be a great year as well. So thank you.
Absolutely. As we're wrapping up, Bill, I'll give you the last word. Anything that you'd like to share with us that we haven't already covered from your perspective regarding Bronson Healthcare, the healthcare field in general, MHA?
Yeah, no, thank you. So I have the opportunity to talk to young people every now and then. And earlier this week, I was in front of a group of our summer interns. And it is exciting for me to see this upcoming generation and how they're leaning into all of the challenges that I've seen over the course of my 30-year career. So I guess if I had to leave on a good note, when I think about this next generation of healthcare leaders and their energy, their enthusiasm, their excitement, it's incumbent upon us to continue to lay a foundation that they can build upon. And I think that's going to be a great future. So as I grow older and will need healthcare more, it's good to know that this generation coming behind us has got great heads on their shoulders. So.
Well said, and I appreciate you leaving on a very positive note. With that, I'd like to thank our listeners for tuning in today and encourage those who haven't already to subscribe to the MiCare Champion podcast across our streaming platforms and visit mha.org to learn more. Thank you so much. We'll talk to you next time.